Good morning and welcome back to Preserve Health Talks.
Good morning.
This morning we're privileged to have as our guest Dr. Rene Loyola.
I'm privileged to be here.
Well, thank you for coming.
Yeah.
Dr. Loyola is a vascular surgeon, retired. He's done medical missionary work, sometimes still doing that, but he's got this whole new concept of aesthetics here in the area, and we thought we'd bring that to you, our listeners, this morning and talk to Dr. Loyola about what he does at Blush Aesthetics.
Perfect.
So tell us and the listeners a little bit about yourself.
Well, I was born in Cuba. I came as a Cuban refugee in the first batch of Cubans that came in 1960. And that was an interesting time. No English, no friends, no school, no nothing. But I'm very thankful because in spite of all that, I've been able to get what I did. So I've always felt the need to give back to anyone that needs help, because people helped me in my journey. And part of my giving back was through surgery. I loved surgery. It was my passion. But it was time to stop because it was killing me. So I had to figure out what to do. I'm not a person that can sit down and just play golf every day or whatever. I needed to do something. So I started thinking, and I'm an artist of sorts. I'm a photographer. I play band and music in a band. I love art. I started reading about medical aesthetics, and before I knew it, blush became sort of my next natural step as to what to do, which is what I'm doing now.
And the concept of blush, the name, how did you come up with the name? And
The name, my wife and somehow came up with it, and she's working there. Actually, we have two hairstylists that work there, and they sort of like the name Blush. So Blush, I'm nothing special.
so what is blush?
Well, we do medical aesthetics, and medical aesthetics is aesthetics without major surgery. There are some minimally invasive procedures when you use neurotoxins, when you use fillers, etc. But it's about enhancing the person's appearance. And what I need to people to understand is that enhancing appearance is not like creating Kardashian-like or influencer-like people. You know, each person is individual, and it's not about beauty in itself. A lot of people think of that and say, well, this is kind of, I don't want to do that. What happens as we age, we change. Well, our appearance changes, and you may feel a certain way about yourself, and you look in the mirror and say, well, it's not really what I'm seeing. So by just modifying a few little things, you can give that person back the confidence that they may be lacking to maybe seek a new job, to become more social, to seek a partner, etc. So it's sort of like an art. It really is an art. It's not cookie cutter. One treatment suits everyone. So that's one of the things that we do that we'll get in a second that makes us a little bit more unique.
So you're promoting a lifestyle, a lifestyle change for these people.
It is. And like I said, it's not just about beautifying for the sake of being, Kardashian-like, if you want to call it. It can change your life completely. And this is why part of the most important thing is the interview you have with the prospective patient. I spend 45 minutes to an hour with them. I get to know them, know what their hobbies are, their likes, their dislikes, their fears, because they're afraid of this, and you need to allay their fears. And you establish a rapport, a confidence, a level of trust, so that they can then feel comfortable when you treat them. So you find out what their needs and what their wants are, you interject and let them know what your opinion is, and together you make a joint decision as to what is going to be best for them.
And while we're on the subject of what's best for them, what services does Blush offer?
Typically, we use neurotoxins. Neurotoxins are chemicals that paralyze, not permanently, certain muscles. And by paralyzing the muscles, the skin that lies above that becomes smoother, so you can get rid of wrinkles, fine lines. But it's also used for people that have something called bruxism, when you clench at night. These muscles in your face, you'll call them masseters, get really strong and tight. By relaxing them, you alleviate that. It's used also for people with migraines. I don't do that. So neurotoxins, fillers. Fillers are substances that you inject into the person's face because as you age, you lose fatty tissues in your face. Things start to droop, not look quite right, and by reestablishing that volume that you lose, you make them look younger. You use platelet-rich plasma and microneedling to give you a glow and sort of make your more youthful look to your face. And we're now doing weight loss also.
And tell our audience who may not be as informed as we are, what is platelet-rich plasma?
Blood is made up of three components. You have plasma, which has platelets, red blood cells, which carry oxygen, and white blood cells that are used to fight infection. So you draw somebody's blood, you spin it, you separate the three components, and then you use the plasma, which is what has the platelets. For some reason, they have found that platelets have an incredible effect on tissue regeneration, regeneration of collagen, which we start losing when we reach our 30s. And that gives you that lack of elasticity in your skin. It's also used for a lot of orthopedic procedures. So you get the plasma with the platelets. And if you have, for example, big bags under your eyes, I would inject directly under the eyes, and then you put the PRP on the face, and you use microneedling, which is a little device that has tiny needles that go through your skin. We use a very good numbing cream, by the way. And you're then pushing that PRP into the dermis, which is where the blood vessels are, and you start to regenerate collagen, elastin, and the platelets speed that up and make it much nicer.
So almost like stem cells.
Yeah, not quite.
Yeah.
Almost.
Okay.
But they're not as powerful, but they have the same sort of effect. And it works really well. I'll tell you, for the bags under the eyes, it's mind-numbing, the change that you can see.
And where is Blush located, and how does it separate itself from other aesthetic practices?
Okay. We are in Downtown Stuart,
Okay.
313 West Albany. It's a 2-story vintage-looking house, which we have tenderly regenerated and made it beautiful so that people have a place they can go in to feel comfortable. It's homey. It's unique. We are unique ourselves, so we got stuff from our travels in there. And, okay, what makes us different? Number one, the time that we dedicate to our patients. We are a small boutique practice, so we have the time to spend with the patients and what we talked about, the consultation, find out what they need, get them to know you, get them to like you and trust you because you care about them.
Right.
And by talking to them and finding out what their needs are, you're showing them that. And then when you come up with a plan, then you establish that plan. The other thing that makes us different is I'm the only injector in the place. I'm a surgeon, a vascular surgeon,
Right.
so pretty comfortable with anatomy and
Yeah.
injecting and things. So we are different. We talked about before, this is not a cookie cutter, not one treatment is for everyone. And we planned that after the consultation, getting to know that person, finding out what they really need and want.
Now, you had mentioned neurotoxins, and I know there are several different neurotoxins. Everyone knows Botox, but
Yes.
there are others.
Yeah.
What other neurotoxins do you use at Blush, and how are they different?
They're different in their molecular constitution, but they have pretty much the same effect. You have something called Jeuveau. You have, there's 2 new ones coming out soon. They're constantly coming out. We use Jeuveau. What's the other one that we're using now a lot? It'll come to me. But they have the same effect. You inject it. It takes about 1 to 2 weeks. And one way that they differ, sometimes the effect kicks in a little bit sooner than others. But by 2 weeks, you should have the full effect. And what I do is I see them at 2 weeks, and I use small amounts because you can always add more. You can't take it away. You don't want a face that looks like this. So little is more. I see them in 2 weeks. If they're happy, perfect. And I document what I use. So the next time they come, we treat them the same way.
And the duration of action of the neurotoxins is about the same?
And we am pretty much so, but it varies. For example, people with high metabolism will use up their neurotoxin more. But about 3 months to 6 months is about the average.
And they cost roughly about the same.
You go by the unit that you use. We tend not to be the most expensive people around. We charge about $15 a unit. Other places charge a lot more, some people less. Just like everything, but this is what we're comfortable with, and we feel that it's, adequate price.
And
for
can
the
you
patient.
ballpark the average number of units per treatment?
Good question. I had a young girl come to see me. She was smaller than you, and asking me if I could help her. She had gotten injected with 75 units of a neurotoxin, which is an outrageous amount. She looked like this. On someone like you or me, maybe 45 units. And pretty much you use it for the forehead, the area in between your eyebrows, and your lifelines. There are other places you can use them too, but 45, 50 units, you maybe a little bit less, but you don't need them at all, but for people with smaller features, but that's about average. And it lasts about 3 months, sometimes 6 months.
And you've recently gotten into diet and weight loss medicine at Blush. So how does that work at Blush, and how can someone get started on that in the cost comparison?
Okay. I don't know if you're aware, you probably are doing what you do, but 75% of Americans are overweight. And of those 75, 45% are obese. So it's not just a
Yeah.
question of how you look or whatever. This is a health issue.
It is.
And it's a crisis. But for once, we have medications that really help. They work. And it started with Ozempic, and semaglutide is the product there. There's something called tirzepatide, which also works. There's several, and next year there's 2 coming out, which are supposed to be much better with less side effects. So what they get from us is another thing that separates us is they'll come, they get a consultation with me. I'll do full physical exam, history, allergies, medicines, etc. There are some contraindications. If somebody has had thyroid cancer, pancreatitis, they should not get this treatment. So you get all that down, you get a baseline blood panel on these people, and then we start them. The original price is about $675, and that covers my physical exam, the history, the blood test, and 2 months of treatment. Then it's about $450 a month. And again, they have me available at all times. I talk to them all the time. If they have nausea, they have whatever, we have medications that we can give them. If they're afraid for certain things, they can always reach me, and I'm there for them.
So who wouldn't want this? Beauty, weight loss, getting treated by a renowned vascular surgeon.
I would think a lot of people.
I would think a lot of people. And so if people want to sign up, how do they reach you?
The number is right there. And our number is 772-266-8311. By the time the patients come, I usually give them my cell number because I need to be available to them for whatever. I tell them no question is too stupid. No fear is too idiotic. Call me. I'm there. I don't have any problems with it.
We want you back on our show.
I
We're
wanna be
running out
back.
of time. Thank you so much for coming in this
You're welcome.
morning and talking with us.
Love having me be here.
It's been
Thank
an
you.
absolute pleasure.
Thank you.
Okay.
Thank you.